On to the health sector now. Dr. Naa Barnabas Gandau, a renowned gynaecologist and fistula specialist, is calling for stronger community engagements to tackle the stigma faced by fistula patients and survivors. He stressed that reintegration of affected women into society requires active involvement of health professionals, particularly within faith communities, to curb discrimination in places such as churches and mosques. Dr. Gandau noted that the stigma can be reduced when respected health professionals publicly interact with survivors, dispelling myths that they are unhygienic or offensive because of the condition.
Fati and Fatima, residents of Dabozesi in the Mamprugu Moagduri District, have endured physical trauma, rejection and isolation for over 20 years due to obstetric fistula. The condition, often caused by prolonged or obstructed labor, resulted in involuntary urination and in many cases a persistent odor. Though both are active farmers, they revealed in an interview with our correspondent Noah Nash that stigma has crippled their livelihoods, as buyers often avoid their produce and they are excluded from community gatherings.
I was pregnant and went through prolonged labor. I had to be operated on, but I lost the child. After the surgery, I started urinating on myself without knowing. When I returned home, my husband and family couldn't accept my condition, so I had to leave my marriage. I stopped attending social gatherings because of the smell. I chose isolation to avoid being mocked. Even though I still farm, no one wants to buy my produce. I was pregnant with twins. I delivered one at home before being rushed to Sandama Hospital, but I lost both babies. Afterwards, I began urinating involuntarily. People started calling me Wee Wee Queen. My husband supports me, but I can't bear intimacy anymore. The urine leaks without warning, and the name calling was too much. That is why I live alone now.
Salamata, a 78-year-old visually impaired woman, recounted how support from her daughter eased the burden of living with fistula before she lost her sight. She said her daughter remains her only source of joy. Meanwhile, the Queen Mother of Dabozesi, Pa'ana Tahibo Aisha Muhammad, expressed concern over the absence of healthcare facilities in the area. She lamented that the high cost of treatment keeps many women from seeking care, worsening their conditions and prolonging isolation.
In this community, we don't have a clinic. The Dabozesi community has no cheap compound, not even talk of a clinic. Still, in this community or in the neighboring communities, we still have women who give birth and lose their babies and still fall in the fistula, obstetric fistula arena or zone. They still fall into it.
Dr. Gandau emphasized that efforts to end stigma must go beyond surgery, with a strong focus on education, faith-based support, and public endorsement of survivors by trusted health and religious leaders.
The only way people get to know that this person has been treated, do you know where? In the church, in the mosque, in the market. Train them, send them to the community. Sit down with the fistula patient, eat with her. The whole community will understand that, yes, they've been fixed. They are no longer smelling urine. They go to the mosque and pray. Everybody will understand them. But they will fix your prayer now, go back home. She will still go into hiding. But nobody believes her, not even the family.
In the fight against fistula, community acceptance and education remain just as critical as access to medical treatment.